But first, Cameroon-born virologist John Nkengasong has won the Virchow Global Health Prize. The €500,000 award recognizes those dedicated to improving the health of the world's most vulnerable people. Nkengasong is currently the US's Global AIDS Coordinator, but for 6 years before that, he was head of the Africa Centers for Disease Control. In this position, he was praised for how he steered Africa's COVID response. I caught up with Nkengasong after he received the Lifetime Achievement Award, and I asked what his greatest concern was as the COVID-19 virus emerged during his time as Africa CDC Director.
My greatest concern at the time, that is around the period of December 2019 and early 2020, was that the continent was terribly ill-prepared for such a fast-moving virus, a virus that we saw what was happening in China, we saw what was happening in Europe, and saw what was happening in the United States. And those are all economies or countries that were heavily developed and could address such fast-moving pandemic. But yet the devastation there was, so I think it was very obvious that because of the weak health systems that exist on the continent of Africa, it was going to be very challenging to battle the virus. As the saying goes, you go to war with what you have and not what you need. So I had to rally the continent, and we went to war against the virus with what we had at our disposition at that time.
And at any point, did this concern turn into fear dealing with the unknown?
It was characterized by a lot of fear. Personally, I was afraid of the enormity of what could possibly happen. Remember, this was an unknown virus. Nobody knew how it causes disease. We knew very little about the modes of transmission. And very importantly, we had no diagnostics, we had no vaccines, you have no treatment. So we were dealing with a disease that actually was new, and we had no countermeasures to fight it. So it was pretty scary to start with.
Do you think the continent as a whole did its best to fight the pandemic?
I think the continent of Africa was exceptional. When the history of the pandemic will be written, I'm very convinced that there will be a whole chapter devoted to the coordination mechanism that the continent put together under the umbrella of the African Union, led by Chairperson Moussa Faki, the African Union Commission, the Secretariat, and of course, President Cyril Ramaphosa of South Africa, who was the chair of the African Union. Those were two enablers that allowed the Africa CDC to actually do its job. I think the continent, there's a lot of lessons to be learned from how the continent responded. I remember very early on, there were predictions that almost 6 million Africans would die in the next, the very early 6 months of the outbreak or pandemic. It didn't happen. And I must say that it's not because people were not infected. People were infected on the continent. But because of those measures that the continent took as a whole, it blunted the spread of the pandemic very early on. I think the continent should absolutely take credit for its bold political leadership and the coordination mechanism that they put in place.
Okay, what is the biggest lesson, or what major lesson do you think you will take with you or from dealing with the pandemic that will inform your outlook in your current job working to control the HIV/AIDS pandemic?
I think there are three lessons that I've reflected over in the last close to 3 years of this pandemic. One is that as humanity, we are more connected than we thought, and that as humanity, we are more vulnerable than we thought, and as humanity, the inequalities and inequities that exist are not necessarily as a result of the COVID-19 pandemic, but were there before. And we need to work on addressing those inequalities and inequities, because failure to address those inequities results to a serious security threat all over the world. We saw how the emergence of the Delta virus variant in India, or the emergence of the Omicron that was detected in South Africa, Botswana, quickly became a threat to everybody in the world. So a threat of this disease outbreak anywhere in the world threat everywhere in the world. So I think that is the major lesson that we should all remember from this pandemic.
Okay, Dr. Nkengasong, thank you very much for speaking to us, and once again, congratulations on the prize. That was Dr. John Nkengasong, currently the U.S. Global AIDS Coordinator, and he was formerly the head of the Africa CDC.